I recall distinctly late 68, early 69, there was a definite need in the community. Those people who were underinsured or had no insurance whatsoever, where do they go? What do we do? So that's how the whole idea got started. And that involved weekly meetings, either at Dr. Pickering's house in the basement or at the old Westport house. We need a community type of health center, a community-based location that we can answer those questions to these people.
You know, we really are going above and beyond. Like, we want to make sure that people in the community are taken care of at all levels. So we want people to have access to health care, we want affordable health care, and we want quality health care.
The system is set up to only pay attention to you when you're sick and when you have money.
So today, I think the intent of KC Care is to be true to its vision, which is creating healthy solutions for the community. I think community is a big word, and it's perfect because it speaks to the vast offerings that the center provides today to Kansas City.
I think it's critically important to have these neighborhood-based, community-based, quality health centers where members can come in because maybe they are having an emergent issue, but they end up walking out with a primary care provider and more information about what they can do to prevent those types of things from happening to them and to their loved ones.
Well, when I found out I was pregnant, it was late. It was 3 months. So when I got care at KC Care, I was very nervous, I was all over the place. So even from walking in the door, from the receptionist to the nurses, they just gave me a lot of support, made sure I was calm, and made sure I didn't need any, if there was anything I needed, they got it for me. And then when I met Dr. Ryan, I think that we had so much in common, and she just calmed me down. Every worry I had, every question I had, she was always there to support me. And I think the second time I went, I knew that I would, have long-term care at KC Care with Dr. Ryan.
They like to say, you guys are God sent, are blessed in the community because I can come here, get tested, see a doctor, get my prescription, and I don't have to worry what if I'm gonna have money to eat the next day.
Just to have that small impact and be able to do my part to help, it's just so rewarding.
The impact of KC Care on me personally has just been incredible. Every day I was touched and I was changed by my experiences there. I'm just grateful for that opportunity. It made me a better person.
Here's this world of people from all walks of lives, from all types of lifestyles, kind of working together, serving people from everywhere. And that directly came from my first introduction into KC Care and the internal environment of employees and the external environment of the people that we serve. And so that people, when they think KC Care, they're able to associate KC Care with a person. And so they feel comfortable coming through our doors and feel more familial as opposed to just that organization over there.
The biggest value for me is, sitting at the front door and seeing someone come in and thinking, okay, it could be a guy that just finished his construction job, it could be a student, it could be, a senior citizen. They're all just trying to live their lives and go to work and take care of their families, and they need and deserve good care.
So I was without health insurance for probably about 10 years. Regular office visit just for TransCare went from $20, $15 or $20 to $90. So having the resources at KC Care made a vast improvement in just the basic TransCare that I had.
I found myself in a time of need where my dad didn't have a job, where I was fortunate enough to have some health insurance, but it wasn't great and it didn't cover anything. And there was a community health center there that was there to make sure that I received the treatment that I needed to save my life.
Me getting the care that I get can change, my attitude when I leave. for someone else that may need a referral or may need just a support or just a nice word to keep their head up, during the day. I think it really can turn a community around.
Not everybody can afford the government insurance, and some people are stuck between Medicare and no insurance, and they have no way to get health care. And in this time, and especially with everything going on, we need community centers more than ever.
We need community health centers because there are so many people on the street now and impoverished people that need our help. We need to do our part.
I think that community health agencies, and especially ones that are in the same kind of program and the same kind of structure that KC Care is, are vital to keep people alive. You save lives.
The vision statement has changed wording and maybe gotten a little fancier in the process, but it's still the same, that every single person, regardless of any of their circumstances, has the right to access quality health care.